Amy Coney Barrett, and healthcare is at the center of her confirmation fight. Over 20 million Americans get their health insurance through the Affordable Care Act. It's headed to the Supreme Court, and your administration, Mr. President, is advocating for the court to overturn it. If the Supreme Court does overturn that law, those 20 million Americans could
Hi, I'm Dr. Amy Killen. I have my own medical practice, and I've been using Doodly now for a few weeks to create these really fun videos to share with patients,
It's in court because Obamacare is no good. But then I made a decision, run it as well as you can to my people, great people. Run it as well as you can. I could have gone the other route and made everybody very unhappy. They ran it. Premiums are down, everything's down. Here's the problem. No matter how well you run it, it's no good. What we'd like to do is terminate it. We have the individual mandate done. I don't know that it's going to work. If we don't win, we will have to run it, and we'll have Obamacare, but it'll be better run. But it no longer is Obamacare, because without the individual mandate, it's much different. Pre-existing conditions will always stay. What I would like to do is a much better health care, much better. Will always protect people with pre-existing. So I'd like to terminate Obamacare, come up with a brand new, beautiful health care. The Democrats will do it because protecting people with pre-existing conditions. And one thing very important, we have 180 million people out there that have great private health care. Far more than we're talking about with Obamacare. Joe Biden is going to terminate all of those policies. These are people that
care. The public option is an option that says that if you, in fact, do not have the wherewithal to be, if you qualify for Medicaid and you do not have the wherewithal in your state to get Medicaid, you automatically are enrolled, providing competition for insurance companies. That's what's going to happen. Secondly, we're going to make sure we reduce the premiums and reduce drug prices by making sure that there's competition that doesn't exist now by allowing the Medicare to negotiate drug prices with the insurance companies. Thirdly, the idea that I want to eliminate private insurance, the reason why I had such a fight with 20 candidates for the nomination was I support private insurance. That's why not one single person with private insurance would lose their insurance under my plan, nor did they under Obamacare. They did not lose their insurance unless they chose they wanted to go to something else. Lastly, we're going to make sure we're in a situation that we actually protect pre-existing. There's no way he can protect pre-existing conditions. None. Zero. You can't do it in the ether. He's been talking about this for a long time. He's never come up with a plan. I guess we're going to get pre-existing condition plan at the same time we get the infrastructure plan. That we waited 17, 18, 19, 20. I still have a few more minutes. I know you're getting anxious. The fact is that he's already cost the American people because of his terrible handling of the COVID virus and economic spillover. 10 million people have lost private insurance. And he wants to take away 22 million more people have Obamacare, and over 110 million people with pre-existing conditions. All the people from COVID are going to have pre-existing conditions. What are they going to do?
I have a follow-up for you, Vice President Biden. It relates to something that President Trump said. He's accusing you of wanting socialized medicine. What do you say to people who have concerns that your health care plan, government insurance option, takes the country one step closer to a healthcare system run entirely by the government?
I say it's ridiculous. It's like saying that the idea that there's a public option, people can choose. That makes the difference between the president. I think healthcare is not a privilege; it's a right. Everyone should have the right to have affordable health care. And I am very proud of my plan. It's gotten endorsed by all the major labor unions, as well as very proud of my plan. A whole range of other people who, in fact, are all the major labor unions, as well as this is something that's going to save people's lives. And this is going to give some people an opportunity. This is something that's going to save people's lives. How many of you home are worried and rolling around in bed tonight wondering what in God's name have health care for your children? How many of you home are worried and rolling around in bed tonight wondering what in God's name are you going to do if you get sick? We have to provide health insurance, home insurance, and an affordable rate. That's what I've gone under.
President Trump,
he was
provide
there
health
for
insurance
47 years.
And an affordable rate. That's what I do.
He was now there as vice president for 8 years, and it's not like it was 25 years ago. It was 3 now there as vice president for 8 years, and it's not like it was 25 years ago. Less than 4 years ago. 3 and he didn't do anything. He didn't do it. Just he wanted socialized medicine. And it's not that he wants it. His vice president. He didn't do anything. I mean, he didn't do it. He wants socialized medicine. More liberal. It's not that he wants it. His vice president even more. Bernie Sanders wants it. The Democrats want it. You're going to have socialized medicine, just like you want it with Bernie Sanders wants it. We're not going to have fracking. We're going to stop fracking. We're going to stop fracking. Then he goes to Pennsylvania after he gets a nomination. We're not going to have fracking. We're going to stop fracking. We're going to stop fracking. Then he goes to Pennsylvania after he gets a nomination where he got very lucky to get it. And he goes to Pennsylvania. By the way, so far I respect very much the way you're handling this. I have to say. By the way, somebody should ask the question. By the way, he goes for a year. There will be. Somebody should ask the question. He goes for a year. There will be. The same thing with socialized medicine.
Your response.
My response is
the same thing with socialized medicine.
Vice President, your response.
My response is the Biden care proposal will in fact provide for that affordable health care. Lower premiums. What we're going to do is going to cost some money. It's going to cost over $750 billion over 10 years to do it. What we're going to do is going to cost some money. It's going to cost over $750 billion over 10 years to do it. Lower your premiums. And they're going to have lower premiums. You can buy into better plans and have your drug prices drop significantly. He keeps talking about it. He hasn't done billing and have your drug prices drop significantly.
When he keeps talking about it,
he hasn't done things for anybody on health care. Not a thing.
When he talks about a public option, he's talking about destroying your Medicare and health care. When he talks about destroying your Social Security, he's talking about destroying your Medicare. You know, Bernie Sanders tried it. And destroying your Social Security. He tried it. And this whole country governor was a very liberal governor. They want to make it work for his state. He tried it in his state. His governor was a very liberal governor. They want to make it work.
Okay, let's hear what Vice President Biden responds.
I beat all those other people because I disagreed with them. He's running against Joe Biden. He's running against. And I beat all those other people because I disagreed with them. Joe Biden. This is the guy that the actual Medicare said we're in a situation that they're going to destroy Medicare. This is the guy that the actual Medicare says plan to withhold tax on Social Security. If in fact he continues to withhold his plan to withhold 20 years. With no way to make up for it. This is the guy who's tried to cut on Social Security. The idea that Donald Trump...
He tried to get... Social Security.
Let's move on.